And in that 20 years, with strong regulation of tobacco products, we've seen enormous public health gains. We've seen a 27% relative reduction in tobacco use globally since 2010. So when we look at tobacco control, we need to look at the big picture and we need to know what's working. And the evidence shows that over a sustained period of time, strong regulations to reduce demand and supply for tobacco products is having a massive impact on public health, and that impact is a huge public health success. With respect to so-called non-combustible tobacco products, and we're speaking here about a range of different product categories, it's important to recognise that we cannot generalise about the health risks posed by these tobacco products for the world at large. Even within smaller product categories like electronic cigarettes or heated tobacco products, the risks posed by individual products are not the same. We see huge variation within product categories. We see huge variation in terms of how the products are used, how the products are manipulated before use. And so it's not responsible to simply generalise for the world at large about the health risks associated with different products. What we're stressing in the position that we are releasing today is that governments should regulate all categories of tobacco, nicotine and related products to a common minimal level. This means implementing proven tobacco control measures like health warnings, like taxation, like prohibiting advertising, promotion and sponsorship for all categories of products. This is essential to ensure that when we look at the population at large and the health of the population at large, these products do not lead to a new generation of addicts, nicotine and tobacco addicts, and a new generation and wave of health harms. It's essential that these measures are put in place across all product categories to protect public health.
An expert paper that is to be presented at the COP has measures for the future on how to effectively fight tobacco, and it has suggestions that have kicked up some storm, at least in the German media, about banning filters for cigarettes. I already talked to Benn about that, but I wonder whether WHO has a more of a political answer to this question. These suggestions are considered as extreme in some quarters. Is it maybe not very beneficial to come up with something where a lot of people who are basically agreeing that more tobacco control is necessary would say, well, this goes way too far and diverts from the actual issue of taxation and so on? I wonder whether Ruediger might be able to answer this, because I know that he's the tobacco specialist from only a few months ago. Thank you very much.
Thank you very much. And actually, your question is related not only to tobacco control, but also to the Plastics Treaty. And here we have a very strong stand. We do believe that it is high time to ban those plastics because we don't see the health benefits of plastic filters. We see that this is or has been the same tactics of tobacco industry to say, well, filter cigarettes are less harmful. It goes back to the same argument that Dr. McGrady has made just earlier. And we do not see the health benefits of these filters. So therefore, they must be banned because they are the highest pollutants in waters, in oceans, of these plastics that are contaminated also with toxicants. So therefore, yes, we do call for banning these filters.
Yeah, just to add to the comment from Ruediger and answer the question, Christian, about whether countries should be prioritising the ban of filters or other measures. First of all, when we think of tobacco control, we think of a comprehensive set of interventions that governments take to reduce demand and supply. So it's not an either or. Governments need to take different interventions that complement one another to achieve the goal. I think we are eagerly anticipating a proposal from the European Commission for revision of the EU Tobacco Products Directive. And there are a number of different ways in which Germany and countries in Europe can further strengthen their tobacco control laws. One of the issues that we're talking about today are some of the newer generation products, electronic cigarettes, nicotine pouches, heated tobacco products. These were not addressed in detail in the 2014 EU Tobacco Products Directive, and we would encourage the European Commission and EU member states to strengthen their regulation of these products and take the opportunity of a revised directive to do so. We think that they can make substantial progress in tobacco control and address what is a serious issue now of use of these products by children. And just to give you one statistic on this, when we talk about e-cigarettes, the latest data that we have shows there are 15 million children worldwide using e-cigarettes. And in countries that have data, we see use rates among children 9 times higher than among adults. It's clear that it's time for Germany, for the EU member states, and for countries at large to take strong action to address these products. Thank you.